Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Right, Mike, tell me what's going on with your neck.
So stiffness in the back of my neck whenever I reach a certain position looking sideways. So lack of mobility and then pain as soon as I get about 3/4 of the way on both sides.
How much pain do you feel there from 0 to 10?
Once I get to a certain point, 5, and then it just kind of gets worse. Both sides.
What kind of pain? Sharp, dull, aching?
Dull, aching.
And how long this been going on? Just give me a brief history of your neck issues.
Yeah, on and off for probably several years, maybe the last 5 or 6 years.
5, 6 years. What kind of treatments you had for that?
Chiropractor for the most part.
Just joint mobilization?
Yep.
Okay. And so it's difficult for you to rotate.
Yes.
Any trauma or history of accidents or anything?
Not that I know of.
Okay. So give me numbers. We're going to do the range of motion first, and then tell me from 0 to 10 how much is painful, and we're going to do it after the treatment. So extend your neck back.
That's about as far as it will go.
And give me like
Lots of
from 0
cracking.
to 10.
Just stiffness, no pain, really.
Okay, forward.
Same thing.
Okay.
Pretty mobile.
And turn to the left and right.
So
That's tight.
pain starts about there.
0 to 10.
Well, it gets worse as I turn further.
From
So
0 to 10.
Probably goes from a 0 to a 6, 7 as far when I try to turn the most.
And the other side.
Same thing. Starts about here, and then gets progressively worse as I turn further. To
Okay.
about 6.
Okay.
This left side's probably a little worse than the right.
Side bend left and right.
Just stiff, no real pain.
Okay.
Well, I take that back. So now if I go this way, there's a few sharp pains.
And just localize in that area. Anything going down to your arms?
No, just the shoulder.
Okay. All right. So relax. Okay. Yeah. You see the tightness? You see the pulling here? You feel it?
I can feel it. Yeah.
Yeah. It's pulling. It's just sticking out. Yeah. That's very tight. So you said you had chiropractor treatment?
Yeah, I haven't been for probably a month because I've been traveling.
Is that okay?
Any other treatments?
No.
Is it painful what I'm doing?
No.
Okay. You don't remember how did you injure your neck?
I'm not sure I ever did. Lots of sports when I was younger. I had done something.
Did you fall like you hit your head ever for a sports injury?
No.
Not too bad now, actually. Okay, let me get deeper. Make sure this is not painful, okay?
Yeah.
So rotation is more painful than extension and flexion for your neck?
Yes.
Okay, I'm gonna go deep and make sure it's not painful, okay?
Okay.
Oh, it's done. Okay.
Now I have to hold it like this.
Oh man. Okay, I'm sitting down.
Okay.
Technical difficulty.
You can put step on. No, we can't.
It's fine. It's fine. It's all in this area or the other side too?
Both sides.
Both sides. Okay. Have you had any images for your neck or anything?
MRI.
What do you say?
Stenosis.
Okay.
I'm not a fan. Actually,
Okay.
You can scoot a little bit more to your left.
Okay. If we just focus on breaking the scar
So
tissue,
that your leg would be really
it's gonna feel
sliding
cold,
on the
okay?
table instead of picking up. Okay. Now let's sit up. Watch your glasses.
And it's another side too.
Try this.
Is it like worse on the left?
It's a little bit worse on this side.
Fan favorite.
Do you get headaches or anything like that?
No.
Not do it.
You get a lot of scar tissue actually.
You can do both sides, probably there. How's that?
Staying again.
This would hurt too, right?
No.
This one doesn't hurt.
Okay, so
Let's go to this chair. We'll do it in the chair.
okay, let's turn around. I want to see your range of motion and tell me how you feel.
So your feet will be on the
Okay,
floor.
turn left and right. How's that?
It's still stiff.
How much from 0 to 10?
Pain.
The
No
other
pain?
side.
You just feel stiffness and range of motion?
Okay.
It's stiffer than the neck.
So it's
And
three.
the other side?
Same thing, a little stiffer,
Depends.
a little stiffer this way still.
Okay, extend and flex. No pain, just a stiffness, yeah?
Yes.
And you feel it right in there?
Both sides of the neck.
Okay. You did not hit your head, you sure?
No, I'm not sure. I have no idea. I mean, not that I know about.
Okay, you feel that? So you're really tight here, actually. Feel the tightness?
Finish it. I can only do 20.
Okay. You want to take a break and continue or not? For sure. While you are resting, let's do this. We bring all heels up. And then toes up.
You feel that scar tissue here?
Heels all the way up. Too much?
Yeah.
What
I
about...
can go this way. I can't go that way.
Oh, you can go this. Okay, we'll just do heels up then. Is that okay?
You feel this one? You slouch a lot in the front of the computer. Do you?
Huh?
Do you slouch in the front of the computer?
Yeah, I guess.
When you bring
let's
toes
move your
up, what
neck
hurts your knee?
left and right.
Your shins here, where
How's
you're
that?
massaging?
Yeah.
Better.
Got it.
You still feel it or it's gone?
It still feels
Like
some
makeup, you don't just say.
tension in there, but
Yes.
You guys are satisfied?
Oh, wow, thanks.
same thing. I mean, it's still, I can still feel some
Yes.
little bit of pressure. Pain's quite down.
Right.
Oh, thank you.
Skin motion.
Like it.
And you feel it just in those two
Just
spots.
now, it's kind of just right underneath my skull here, my neck.
Relax. Let me know if it's too much, okay? Just those two spots, yeah?
Yeah.
Relax, relax, look straight. Yeah. Mm-hmm. Okay, right again. How's that?
Better.
You still feel it or it's gone?
It's going on that side.
Mm-hmm.
This side just a little bit. And then more actually towards the middle area now, Doc, right here in my fingers.
Okay,
Hand out pretty.
shrug your shoulders up.
Your knee or what?
Yeah.
The same shin?
Yeah. The knee and the shin. This is just the shin.
Okay.
Shrug.
So when you're ready, let's try to do this again.
And relax. Tuck your chin. And relax, relax. Okay, try it again.
It's better.
How's that?
It's better.
Gone or you still feel it?
Now it's gone now.
Mm-hmm. All right, awesome. So what do you think about treatment.
Thank you, Doc.
Yeah, thank you. Any pain?
Nope.
All right, awesome. Thank you so much.
Okay, thank you.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video with the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.